In the face of the COVID-19 pandemic, the Strategic National Stockpile, SNS, the nation's repository of emergency medical supplies, was thrust into the spotlight. The SNS, designed to supplement state and local resources, was intended to be a stopgap for public health emergencies. This report reveals how the SNS, despite its mission, was not adequately prepared for the scale and scope of the pandemic, exposing critical vulnerabilities in the nation's emergency preparedness. The SNS's core functions include maintaining a stockpile of pharmaceuticals, medical products, and ancillary supplies, supplementing state, local, tribal, and territorial resources during public health emergencies, delivering medical supplies to communities within 12 hours of the decision to deploy the stockpile, primarily focused on responses to bioterrorism events and limited outbreaks. Despite its mission, the SNS was not equipped to handle a nationwide viral pandemic. The report highlights, the SNS was designed for local medical countermeasures and biohazard events, not a national or global emergency. It was not created to be the only source of emergency medical countermeasures in a crisis. The SNS was understocked with essential assets, such as PPE. Despite past experiences of PPE depletion, the SNS's budget was primarily allocated for smallpox and anthrax threats, not for a pandemic with a respiratory virus. The SNS stores were nearly depleted by April 2020. Hindering the nation's response, states requested assets at a rate the SNS could not provide. As states are not required to maintain their own stockpiles, the SNS was not able to evenly distribute supplies across all 50 states. Specifically, the report emphasizes, the SNS was not designed to supply the entire country with supplies. The SNS was depleted of PPE in 2009 during the H1N1 outbreak, yet was not adequately restocked. Highlighting a lack of preparedness, the content review process for the SNS was inadequate and not prepared for a novel virus. States are not required to maintain their own stockpiles of medical and ancillary equipment. Localized stockpiles at the state level would allow for faster deployment of resources. State stockpiles could be tailored to the unique needs of the local areas, instead of the catch-all approach of the SNS. The COVID-19 pandemic exposed the critical need to strengthen the SNS and for states to maintain their own stockpiles. Get the full story, understand the hidden forces at play. Order the book now at the link below.